When you have a patient at your hand who is suffering from a certain kind of a mental disorder, it can be a mood affective disorder, or he or she may be suffering from such sort of schizoaffective disorders, schizophrenia, obsessive compulsive disorders. All of these disorders can be treated through a newer technique that is devised these days and is known as the behavioral therapy, or it can be also known as the cognitive behavioral therapy in the sequel right here. So there are different kinds of conditionings that we can talk about. It can be the oppositional conditioning as well as the operant conditioning that we can talk about over here in this section. So primarily in this section, we're going to talk about the definition of the cognitive behavioral therapy. Usually it is the counseling sessions that are carried out between the doctor and the patient, and that basically gives an outlet and an insight to the patient as well towards his or her problems. So that is the mainstay over here when we talk about it, and then we can talk about the hierarchy of the fear in this section as well. Then we're going to talk about the aversion therapy that is being carried out, and that is usually coupled along with the cognitive behavioral therapy over here. So usually the classical conditioning is being carried out. You should remember the technique of the Pavlov experiments that was carried out in the past. That is basically a very good example of the classical conditioning. So this is how the patients are conditioned even through the behavioral techniques or the behavioral therapy that we're going to talk about right now. It's basically a systemic desensitization, the behavioral technique to treat the phobias, in which the client is asked to make a list of the fears and taught to relax while concentrating on them. Then we have the counter conditioning phenomena as well, that is replacing an old conditioned response along with the new one by changing the unconditioned stimulus over here. So the counter conditioning is the technique that was devised by the Pavlov in his experiments, where he put a dog, and basically the ringing of the bell was coupled with the food that was being offered to the dog. So usually when he gave food to the dog, the ringing of the bell was coupled with it. And after he stopped giving food to the dog and just rang the bell, the salivation was still produced. So this is known as replacing a conditioned response with a new one. This is with a new one that is changing the unconditioned stimulus. The unconditioned stimulus is basically the ringing of the bell in the experiments of the Pavlov that he carried out and that we've already studied. So over here, when we talk about the behavioral therapy and the classical conditioning phenomena, the thoughts, they create the feelings over here. It's basically a triad that we have to talk about over here. The feelings, they create behavior in an individual, and then the behavior is reinforced by the thoughts, and it's basically a vicious circle that starts after the motivational interviewing that is carried out. So when we talk about the fear hierarchy over here, you can just have a look at the table. The situation can be being bitten by a rabbit. The fear level is at almost 100. Then petting a rabbit on the head, that is going to create or fall the fear level to the 90 level. Then petting a rabbit on the back, that will certainly lower the fear level to almost around 80. Then holding a rabbit is again going to put the fear level at 70. Touching a rabbit held by someone else is almost at 60. Seeing someone I trust and I hold a rabbit, that is basically going to more decrease the level of the fear at almost 50. Then being in a room with a rabbit is almost at 40. Thinking about petting a rabbit is at 30. Looking at the pictures of rabbit at 20. And watching the movie Hop is another quite an interesting movie that is about rabbits and giving you information about the rabbits, or giving a more friendly view about this animal, which a certain person can have developed phobias to. So this is basically how you gradually desensitize the patient towards certain phobias that he or she is suffering from. Then we have the aversion therapy, a form of behavioral therapy in which an undesirable behavior is paired with an aversive stimulus to reduce the frequency of the behavior. So this is how we define this aversion therapy over here. So putting a cigarette in the mouth is basically coupled with a pleasurable stimulation, and so the person continues to smoke. Then we have the rapid smoking phenomena, nauseating feeling, and a desire to smoke is reduced. So this is the aversion therapy. When you couple this putting a cigarette in a mouth with rapid smoking phenomena and creating that nauseating feeling, the person is going to stop smoking. This is known as the aversion therapy, when you couple a primary stimulus with a certain kind of a feeling that is undesirable in that individual that we're talking about. Then we have the exposure therapy, a behavioral technique that introduces the clients to situations under carefully controlled conditions that are related to their anxiety or fears. It can be a technique of flooding that we can talk about. What happens over here in flooding phenomena is that the technique for treating phobias, the person is rapidly and intensely exposed to fear-provoking situations, and he or she is basically prevented from making usual avoidance or escape responses in these individuals. Now, on the other hand, we have another technique which is known as the eye movement desensitization reprocessing technique over here. The controversial therapy for post-traumatic stress disorders and anxiety problems. So these are the two conditions that we have to focus on. It can be the PTSD, known as post-traumatic stress disorder, or it can be the people who are having anxiety problems over here that can be treated through this technique. What happens in this technique is that the client is directed to move eyes rapidly back and forth while thinking of the disturbing memory that is creating the problem in his thought or in his thought form or thought content. So this is the eye movement desensitization process. It needs more controlled studies over here. So learning through the observation and imitation of others. So this is another technique that is devised, and it is known as the technique of modeling. This is how do you basically go about and treat a lot of patients who are almost in the adolescent age or in the child age group through this technique, which is known as the modeling phenomena. The participant modeling is again very important. The technique in which the model demonstrates the desired behavior. So usually through observation and through imitation, the psychological content of the individual is catered off. So giving the patient an insight is another way over here. In a step-by-step gradual process, there is this participant remodeling technique, while the client is encouraged to imitate the model over here. So in this section, basically, we primarily went through the different techniques of the method, which is known as the cognitive behavioral therapy. It can be the different techniques, for example, the aversion therapies and the modeling therapies that are devised, and basically the doctor decides what is the variant that is used in a particular patient that we're talking about. So that is the end of this section. Thank you for watching sqadia.com.